So I'm Dr. Guy Haywood. I work at University Hospitals Plymouth and also at the Peninsula Heart Clinic in Plymouth. It's actually a funny thing, but I can remember the precise moment that I decided I was going to be a doctor. And it was actually when I was at the age of 5, I was taken on a very foggy night as a bit of an emergency in an ambulance to Middlesex Hospital after I was bleeding from tonsils. I'd had actually a local operation which had gone wrong, and I got there, I had my operation, and I was looked after by a wonderful pediatric surgeon who was there. And when I got back home afterwards, I can actually remember that I was lying in my favorite little play space and sort of playing with this it was the underside of an armchair, which was my place I like to sort of sit and hide. And I just thought, I'm going to be a doctor. And it just never really changed after that. I always decided that that's what I wanted to be. And I think, it just followed on. It worked for me through schooling and university, and I love being a medical student. So it's all worked out. So I found so much of medicine really when I was a medical student interesting, and but I think cardiology did always seem something a bit special to me because I just saw that there were times when if treatment was delivered actually pretty fast and had to be done right, but you take somebody who was literally looking like they were on the verge of death, and then really quite a dramatically short time afterwards, you'd see them walking out of the hospital with their family looking, really well. And I thought, well, when you can intervene just at one point, at some critical point in somebody's life, and you can turn things around so dramatically, that's a very, attractive thing to be able to do. And so I think that's what initially attracted me into it. And then as far as the heart rhythm disorders that I've specialized in, really, I think the very first time I saw an ablation being done where you just see this precision and skill and the amazing, brilliant engineering that goes into all the mapping and the design of the catheters that are passed up into the heart. And you just see that if you can deliver the energy just at the right spot, then somebody's life that's been really troubled by a really difficult problem, changes actually in one heartbeat, from one heartbeat to the next, at the moment that, say, a pathway is destroyed. It just changes that they've got effectively a normal heart and normal life, and that's like magic. Well, I think people sometimes say that when they've been talking with me, they really understood what's been going wrong with their heart for the first time. So I hope I'm, good at trying to actually make things that can seem complex into things which are quite intelligible to patients, and they can really get an understanding of what the task is that we need to do to try and fix them and to get them back to normal. And I guess they probably sense that I enjoy my job, so well, at least I enjoy the part that's actually to do with fixing patients anyway. I think I value seeing them actually turning their lives around, because an awful lot of patients have quite a lot of fear surrounding the condition that they've got when it starts to affect them and they don't fully understand it. They often get quite dispirited because they aren't able to do all the fitness things and things they've been doing before. They often put on weight and their lives start to really, go downhill. And if we can turn around that situation with the right treatment, and they can actually start to enjoy life optimistically again and get back to feeling their old selves, then when you contact them a few months later and you hear that, I think that's a tremendously rewarding part of the job.